In earlier video, I promised that the topic of pulmonary embolism will be covered in 2 videos. I don't think that is possible, so I'll try to cover it in 3 instead of 2. We know that pulmonary embolism is a condition in which blood clots that are formed in venous system, most usually in deep veins of legs, travel to right atrium, right ventricle, and then to pulmonary arteries and cause blockage. Blood clots are known as emboli, and that is why the condition is known as pulmonary embolism. Deoxygenated blood has to go to lungs through pulmonary arteries to absorb oxygen, and as a result of presence of blood clots or emboli, the process is disrupted. Lungs cannot absorb enough oxygen, and patient develops tachypnea, hypocapnia, and hypotension. Now, tachypnea means rapid breathing. Hypocapnia means decreased amount of carbon dioxide in blood, and hypotension means low blood pressure, which can cause syncope, which is the term used to describe transient unconsciousness. A few CT scan images. This is an axial CT scan image, contrast enhanced CT scan at the level of pulmonary artery. This is main pulmonary artery dividing into right and left pulmonary arteries. This is a big blood clot here. This is another clot that is going into left pulmonary artery, and this is a clot as well. This is ascending aorta, descending aorta, superior vena cava, and right main bronchus and left main bronchus. This is esophagus. Coronal reconstruction of CT scan images showing a big thrombus here going into the branches of right pulmonary artery. There is an emboli here as well in left pulmonary artery. Intact pulmonary vasculature is also visible. Notice a decreased amount of blood vessels in this area. Another view, you're sort of looking from top, and this is the main pulmonary artery again. Blood clots are very clearly visible. Intact pulmonary vasculature is also visible. This image and the one before were copied from www.redrounds.com with kind permission. What causes it? We know that pulmonary embolism is a serious complication of DVT rather than a disease itself. So anything that can cause DVT would potentially result in pulmonary embolism. There could be 3 main causes that can cause thrombosis in veins and eventually pulmonary embolism. Hypercoagulation. So we need to understand what is coagulation. Coagulation is known as blood clotting in common language. It is the ability of blood to form clots, and it is very important. When you get a cut, the body stops bleeding by forming a clot at the site of cut. Some proteins in blood work with platelets to form clots. Most important of these proteins are protein C and protein S. Both are vitamin K dependent proteins, and antithrombin 3, which is also a protein. All are found in bloodstream and work as a natural blood thinner. Deficiency of these proteins increases the risk of blood clot formation in bloodstream, which can eventually cause pulmonary embolism. Presence of clots in arteries arising from aorta can also cause stroke and heart attack. Hypercoagulation means blood has a tendency of abnormally making blood clots. Damage to the endothelium of the vessels also increases the risk of clot formation. Stagnation of blood, if the patient is just lying in one place or traveling in an aeroplane for a very long time, they can also develop blood clots in leg veins. How embolism causes pathology. Pathology occurs as a result of occlusion of pulmonary artery or its branches, and severity depends upon the size of thrombus and location of occlusion. It can cause dead space in lung, infarction, and hemorrhage and edema. So we'll discuss what these 3 things are. If a branch of pulmonary artery is occluded, say for example from here, then perfusion, which means blood supply to that area, ceases, and the purpose of ventilation, which means air supply, becomes dead. Means it really does not matter how much oxygen is coming into this area, it would not be absorbed by blood because there is no blood passing through the capillary bed of the alveoli. If the area is relatively small, then patient starts hyperventilating, which means the rapid breathing to compensate for the area that is affected. So this will be known as a dead space in lung. Hyperventilation results in hypocapnia. Hypocapnia means that the level of carbon dioxide in blood is lower than what it should be. Now, the common understanding that carbon dioxide is harmful for body is very wrong. Blood and body needs certain amount of carbon dioxide to function properly. The balance should not go wrong. Infarction. The word infarction should not be confused with infection. Infarction means death of a tissue as a result of shortage of blood supply. For lung tissue to infarct, it is necessary that 2 of 3 sources of blood and oxygen supply stop. Lung tissue has 3 sources of blood and oxygen supply. Number 1, blood supply through pulmonary arteries. Number 2, oxygen present in alveoli. And number 3, blood supplied by bronchial arteries, which can arise from several aortic branches. If 2 of these supplies shut down, infarction can occur, which often shows as atelectasis on a chest x-ray and often results in raised hemidiaphragm on the affected side. If infarction does not occur, hemorrhage, pulmonary hemorrhage and pulmonary edema will also be caused as a result of pulmonary embolism. Risk factors again: recent surgeries, especially hip and femur, women on oral contraceptives, postpartum periods, immobility, protein CNS deficiency, antithrombin 3 deficiency, congestive heart failure, and DVT in PARC. Signs and symptoms: tachypnea, respiratory rate more than 16 per minute. 96% of the patients present with this symptom. Chest pain, pleuritic in nature, 88% of the patients. Dyspnea, cough, hypotension in case of massive PE. Hemoptysis means when patient gives off blood with cough. Syncope, which is transient loss of consciousness. Now, diagnosis is made by chest x-rays, pulmonary angiography, CT pulmonary angiography, and nuclear scan test. ECG is also involved. Chest x-ray may show atelectasis, pleural effusion, pulmonary artery dilatation, along with some other things, but sometimes fail to show any abnormality. CT pulmonary angiography is the investigation of choice, and we have seen several images, so we don't want to go back there. Nuclear scan, ventilation and perfusion scan can reveal how well the blood supply is to lungs and how well air reaches to lungs. These are 2 different tests usually performed together. This is the ventilation perfusion scan performed on a woman taking oral contraceptive with suspected pulmonary embolism. So image on your left hand side, A, after inhalation of xenon 133 gas, images were obtained in posterior projection showing uniform ventilation to lungs. Means that oxygen supply to lungs is not disrupted. Image B is a perfusion scan that shows if the blood supply to the areas of lung is disrupted or not. Technetium 99 was injected to these patients and images were obtained. The exam revealed decreased activity in apical segment of the right upper lobe, anterior segment of the right upper lobe, superior segment of the right lower lobe, posterior basal segment of the right lower lobe, anterior medial basal segment of the left lower lobe, and lateral basal segment. Now, for a person who is trying to learn, it would be very difficult for them to understand this, but I would like to show this area which should be easily understood. And this shows a decreased amount of perfusion. So it means that the pulmonary artery before this area, that is supplying to this area, has been blocked by the thrombus. ECG and laboratory tests as well as diagnosis will be discussed in next video. The lecture is prepared for www.academyofprofessionals.com, and these are the references. And thank you to anybody who contributed for me to prepare this lecture.